Welcome to Between the Sheets, the non-judgmental podcast where we're going to cover various sexual health and wellness topics. I'm your host, Dr. Stephanie Zwonitzer. I'm a urology and sexual health nurse practitioner, and I love helping my patients and listeners discover and develop their most satisfying sexual experiences. Between the Sheets is here to normalize the conversations about sexual health and cover everything from basic anatomy to the most taboo topics and everything in between. Real talk, real pleasure, one episode at a time. So come on, let's get between the sheets. This episode is sponsored by Boston Scientific and its educational website on erectile dysfunction, edcure.com. One study estimated that more than 50% of men over the age of 40 have some degree of erectile dysfunction, which can be frustrating and confusing. Go to edcure.com to find information on erectile dysfunction and treatment options, including long-term treatment options offered by Boston Scientific. Boston Scientific does not endorse any statements or opinions expressed during this episode. Welcome back to Between the Sheets, everyone. I am geared up for today's episode because this is a topic I have wanted to talk about on here for a while because I deal with this with a lot of my guys. We are going to talk about men's pelvic floor health and how it affects their sex lives and how they can have a better sex life. And I have Susie Gronski here with me today. She is a doctor of physical therapy. She is a pelvic health therapist. She is a certified sexuality counselor and educator. All of the wonderful things that I love. And she is based in Asheville, North Carolina. Welcome, Susie.
Thank you so much for having me on your podcast, Stephanie.
Yeah, you're welcome. So I find that there is so much benefit for my patients from a urological perspective, sexual health perspective, in going to pelvic floor physical therapy. And yet I find that some pelvic floor physical therapists only specialize in women. So I'm struggling to find ones that will take my guys and help them. And that some of my guys are resistant to going to physical therapy because, well, how is that going to help me? I'm a big, strong man, you know? So tell me, how did you get into the men's side of things and how can I encourage my guys to go see you?
Yeah, so I started in this work over a decade ago and I had a practice in Illinois.
Mhm.
I started it very generic, manual therapy, pelvic floor therapy. And at that time, my education was women's health specific. As you already mentioned, pelvic therapy is historically known as being gynocentric or female centric. And men who have concerns below the belt really did not have a space to lean into like women might have. Although I do acknowledge that many women and all genders really struggle to find care adequate for their pelvic and sexual health concerns. So it's not just the men who are struggling, but in general, pelvic therapy access is challenging for many of us. So just acknowledging that. So when I started my practice in Illinois, men were reaching out to me asking me for help because they would read the website and say, I have many similar concerns, urinary incontinence, pelvic pain. I just had prostate cancer diagnosis and had my prostate removed or radiation therapy or testicular pain. You name it, they were reaching out and saying, can you help me? Am I an advocate or am I considered a candidate for pelvic therapy? And I said, sure. Like I didn't have any education in men's pelvic health, but I said, I will help you, right? So that compassion drove me to welcoming men into my space and also their bravery to allow me to learn alongside them.
Yeah.
They trusted me to be with them on this journey. And that's where it all started, is asking them questions, leaning in with curiosity and compassion, and allowing myself to really expand my comfort zone when it comes to pelvic therapy to treat the genitals of people who have penises. And my book, Pelvic Pain, The Ultimate Cockblock, came about because of the work that I did with men in this space. And I continue to be an advocate for them as well. And so to your question about how do we encourage people who have penises to reach out for help, it's doing what we're doing now, Stephanie. It's having these conversations, breaking the barriers around the stigma and taboo, equalizing the playing field and bridging the gap that exists as far as accessibility for pelvic health for men in these spaces. And the more that we do that, the less scary it will be. And the more that we build a trust in the community and just be real with people and ensure that we're not going to judge them
Hmm.
or shame them or embarrass them or misconstrue the situation, the easier it will be for men to reach out for help.
Yeah, absolutely. Physical therapy is not just if you broke your leg or your arm or you fell down the stairs or something like that. There's so many benefits to it, and specifically for pelvic health. I mean, like you mentioned, it affects your sex life, it affects your pain, it affects your ability to urinate correctly, have bowel movements correctly. There's so many things that happen in our pelvic floor that when we are misaligned, our strength is off, we're overly tight, whatever, it really has an effect on multiple areas of our lives.
It sure does. Pooping, peeing, and sex are vital everyday functions. And
Yeah.
although certain situations might be common as we get older, as our bodies change or relationships change or bodies do body things sometimes, it's not normal. So any issue that is bringing distress in your life related to bladder, bowel, or sexual function, there is help and there's support.
Yeah, I love that. So, all right, let's go through some patient scenarios of when I get to send my guys to you. So, if I have a younger gentleman, this happens all the time. They come in their 20s and 30s. They just chronically have pain. They think it's testicular pain. They think they're dying of testicular cancer, right? We do the scrotal
Mhm,
ultrasound. It's totally benign. I do an exam.
mhm,
It's totally benign. I don't
mhm,
have a good reason
mhm,
anatomically from a urological perspective as to why they are having this pain, but they are adamant that they are having this. And I'm like, all right, let's try pelvic floor physical therapy because I'm out of ideas, but I know my partners in pelvic floor health can sometimes come in and find things that I didn't notice. So if
mhm.
I send one of these guys to you, what are you considering? What are you doing for them? How can that help them?
Yeah, that's such a great case scenario, which is more common than people think. So, scrotal pain. As you mentioned, we want to rule out the red flags, right?
Yeah.
So, if there isn't an infection like epididymitis, if
Hmm.
there isn't anything sinister like a cancerous nodule, etc., and all that has been ruled out, we can definitely suggest that this is highly musculoskeletal in nature. And what I mean by musculoskeletal in nature is that you do have muscles and nerves that support the scrotum.
Hmm.
And they actually extend from the lower back. So,
Hmm.
your lumbar spine, your sacral spine, those nerves of your back course through the abdominal wall and into the perineum to supply the skin of the scrotum and the muscles of the scrotum. So, as a pelvic floor physical therapist, my job is to rule out referred pain patterns and to listen to the person's history as far as what in their timeline might have triggered something to get crabby. So, putting the pieces together in the examination process, we're doing spinal mobility testing. We're looking for if symptoms are being alleviated or provoked with certain spinal movements,
Hmm.
flexion, rotation, etc. What a lot of people don't know is that the cremaster muscle, which is the muscle that essentially is responsible for elevating the scrotum and relaxing the scrotum, if there's nervousness or if you're cold, the scrotum will elevate and lift. And if you're really warm or if you're relaxed, the scrotum then descends.
Hmm.
And so there is this muscle called the cremaster muscle, which is an extension of your internal abdominal oblique.
Mm.
So your ab muscle and your scrotal muscle is the same, just named differently. And the nerves that supply the scrotum are coming from the lower back and from the pelvic region. So our role here is to determine what are the potential triggers and contributions to the scrotal pain from that perspective. Now, knowing what we know about the contents of the spermatic cord and the testicular region, certainly you have the testes, the epididymis, but within the spermatic cord, which houses sensitive structures
Mhm.
like vasculature and veins and also lots of nerves. So you
Mhm.
have spermatic nerves that live there, which are autonomic nervous system nerves.
Mhm.
Okay. They're not like peripheral nerves that supply, your skin or muscles. And the autonomic nervous system is just that, it's autonomic. But what influences the autonomic nervous system is, guess what? Nervousness, anxiety, pain can definitely elevate that.
Mhm.
I'm not saying that anxiety or nervousness is cause for testicular pain, but it is a contributing factor,
Mhm.
especially when pain persists and there isn't an explanation or making sense of why I'm hurting. So
Mhm.
there's this huge threat hanging over the individual because of the lack of knowledge or understanding and reassurance from a medical provider, which then perpetuates the system of protect from threat. So your bodily protective responses ramp up, and that includes your immune system, your musculoskeletal system, the nervous system, the hormone system, and it continues to reinforce this message of protection, right? And so, as a pelvic therapist, my role as well in this scenario is to reassure people that they're safe, that they
Mhm.
might be sore, but they're safe. And there are many things we can do to dial down that pain. And that might be manual therapy techniques to mobilize the scrotal tissue, to bring in circulation, to relax muscle tension. The pelvic floor, in most cases, has a greater tone situation where
Mhm.
there's tension and a lack of voluntary relaxation, which then contributes again to the messages of protect from threat, and tissues continue to get crabby. So, in my role as a pelvic therapist is to help improve independence, autonomy, empower the individual to get back to the things that they love by gradually reintroducing them to certain movements that they might do or they've been avoiding. For example, exercise. A lot of people will stop, working out, going for hikes
Mhm.
because they're just afraid. And let's talk about the sex part.
Yeah.
Who wants to be thrusting, you know,
Right?
and having sex when, you have these
Mhm.
tissues that should move fluidly and touch
Yep.
other parts of the body, and people are afraid to do that.
Yeah.
Any type of movement or touch through sexual activity might also be
Mhm.
avoidant. So I'm here to again to help reintroduce these activities that they enjoy and want to get back to doing in a gradual way by increasing tissue tolerance, adaptation, relaxing the nervous system, relaxing muscles, and improving all overall adaptation. So does that answer the question
Yeah.
around
Yeah, it
what we?
does. And it's so interesting because I had done some previous work in pain management. And so coming into the urology world, it was like an automatic trigger for me that I wonder if some of these guys have low back issues because
Mhm,
I know that connection of the spinal nerves and going into the genital area and things like that. And sometimes it's like a light bulb moment for these guys like, oh my gosh, I
mhm.
do. I have S1 compromise. And you're like, yeah, man, that goes straight to your perineum. And you're like, we got to work on that. And then we can also work on the pelvic floor and helping it. But if we don't address the root cause, then we're not going to ever get you fully fixed. And it was just so interesting to make that connection with so many of my guys and their pelvic floor issues that I don't know that I would have been as in tune with had I not had that experience in pain management. But it really is interesting how interconnected everything in that area is. Like you were saying, the abdominal muscle becomes the scrotal muscle and all of these things. I mean, it's incredible.
It is very incredible. And I'd like to share a recent story too, now that I heard you talking about some of your patients. It doesn't always have to be like a direct injury or trauma to these tissues. It can be a change in how you're using your body. So, for
Mm,
example, this patient that comes to mind started a new job, and this job is a manager at a grocery store.
mm,
And this person wasn't used to standing on their feet for several hours a day. And
yeah.
so when you start to put together when then this issue, the scrotal ache start, it seems to coincide with when they started
Mm,
to their new job.
yeah.
And so after doing the assessment, we find out, actually, I think there's just an increase in gravitational, like vascular pooling, right? So
Yeah.
people can relate to, like, if I'm on my feet all day, your feet feel a little puffy,
Mhm.
right? Your legs may feel a little sore. And if you rest and elevate your legs, that goes away.
Yeah.
When you're on your feet all day and you're working, right, you might not get a lot of breaks. And this
Mhm.
person hardly took any breaks, actually. And so their body was put into a situation very abruptly to stand on their feet all day and not have much support. And what
Mhm.
I mean by support, boxers. There were no briefs, there was no supportive
Mhm.
underwear around the scrotum. It was just a too much too soon, too quickly situation, and that his body didn't have that much time to adapt. So, just like in the scrotum, you have highly vascular structures
Mhm.
that are veins that can pool, and you might have a bit of like blood congestion or pooling in that
Mhm.
area that might then offset some of the visceral neurons that respond to pressure and changes to heat. that can also signal or be a contribution to this ache. And so what we did, very simple, I said, how about you wear some supportive underwear,
Mhm.
the underwear that has a bit of a cradle within the crotch area, and see what happens there, and take some movement snack breaks. And what I mean by movement snack breaks is use the muscular pump of your calves, do
Mm.
some heel raises, do some squats, move the circulation through your pelvis. Take very short sitting breaks just to change your body, get the variety in,
Mhm.
and wear this underwear. He had 2 years of pain gone
Wow.
after after those suggestions.
Wow, that's amazing. And I've seen it the opposite too, where guys have had maybe they're out in the field and they're doing more things and then they get a higher position where they're more management and now they're sitting more. Same
Right.
thing. They will develop, and that's more of a tension thing because they're sitting, all day. It's it really is just amazing the different things that can change. And it's so funny
Mhm.
because I work by NSA. So we have a lot of different types of engineers over by us. And I have found, like, I literally ask all my guys that come in with pelvic pain that just can't go away. They don't have a real reason for it, whatever. I'm like, are you an engineer? Because I swear 95% of them are engineers and they all carry their tension in their pelvis. I don't know what it is,
Oh.
but these engineers, there's poor guys. So I'm like, go to physical therapy, please.
They're tight ass syndrome.
Yes, yes. They're, like, so high strung and, like, so focused on their jobs, and they just, like, are tense all day long, and I'm like, "We need to relieve some tension here."
Yeah, and the thing is that there's a lack of awareness, right? Not that
Mhm,
the sitting is bad. I'm not here to vilify that. I think it's a situation of lack of variety
mhm.
and lack of awareness. So yeah, I mean, we habitually it happens to all of us, right? I might be driving, all of a sudden I feel like I'm clenching the steering wheel, and I'm like, hold on a second, why am I working so hard here? Like
Yeah,
that's not necessary. And it could be, there's stressors all over, right? Driving can be stressful. You might have had a difficult conversation, and the body does keep the score. And non-consciously, you do have these protective responses. And once we bring our attention to that, we can change it.
yeah,
Right? We can loosen the grip a little bit. We can soften our body. We can use our breath to help relax
mhm.
and ease tension and improve circulation and modulate the nervous system. There are many things we can do to change our habits of body and mind.
Yeah, absolutely. I know. Breath work is one of the things that I talk to them about because, at least I can get them started on something before I send them to you guys and you do your full assessment and give them appropriate activities because not everybody can do the same activities. Not everybody's problem is the
Right.
same, but at least I can get them started on something before they come to you. And I'm like, all right, we need
That's
to
great.
relax. We need to breathe and we need to relax.
That's
Yeah,
right. That's right.
absolutely. Okay, so one topic that I definitely want to get into today because I deal with a lot of guys with prostate cancer. And
Mhm.
post prostate cancer treatment is imperative. They are without erections, they are lacking their intimacy. And there are various reasons for it, but it doesn't matter what type of treatment they have. If they have radiation, hormone therapy, or a prostatectomy, their pelvis
Mhm.
is damaged. And whether that's, the hormones taking away the testosterone so they have no drive, they're difficult getting erections, the radiation changes things, the prostatectomy totally changes things. So let's kind of break it
Mhm.
down. If you have a guy that is, let's start with post prostatectomy. So
Okay.
prostate's now removed. Now they've got to relearn how to pee. They've got to relearn how to have erections. Not that we really cut things up and did whatever, but the prostate is so for anybody who doesn't know, the prostate's below the bladder and your urethra goes through that and so does the release for your semen. So when we all of a sudden remove that, now your body's got to relearn how to do those things.
Right. So glad you went into the anatomy. So before we understand kind of the surgical sequelae or implications of a prostatectomy, it's important to understand a foundation of the anatomy
Mhm,
here. As you mentioned, you have the bladder that's right behind the pubic bone. You have the prostate gland right underneath it, and then you have the rectum, and then this red here, which is extending from the pubic bone all the way to the tailbone. These are the pelvic floor muscles. The
mhm,
deeper layer, which are called the levator. You
mhm,
do have a superficial layer, which is the urogenital triangle, which these muscles essentially are intimately connected to the erectile tissue, sort of like on the outside instead of the inside of the pelvic bowl. And they are really important in erection and ejaculation and orgasm appreciation. And the nerves that supply this area are not injured or damaged during a prostate removal.
mhm.
They actually are intact, which is great news because we can rely on that neuromuscular connection to support sexual function and continence recovery. So if I were to open and look inside, don't try this at home. If we're looking inside the pelvis, again, this is the sacrum, that's the rectum, right? It's nestled right next to it, the prostate, and then the bladder. When the prostate is removed, generally with a radical prostatectomy, the seminal vesicles, which are those two organs that live essentially on the back of the bladder, they create a lot of nourishing enzymes and proteins to protect your sperm,
Mhm.
essentially, and really make up most of your semen.
Mhm.
Those are removed. And the prostate gland is removed entirely with the prostatic urethra. So, part of your urethra also is removed,
Mhm.
and the part of the internal urethral sphincters, a lot of surgeons will try to preserve it as much as
Mhm.
possible, but in that the surgery, it does get injured or
Mhm.
damaged. And then also the nerves around the prostate. So most often these surgeries are nerve sparing,
Mhm.
but not always, just depending on the extent of the tumor growth and the tissues that are involved as far
Mhm.
as the percentage of preservation of those neurovascular structures. And those nerves are called the cavernosal nerves, and they supply the erectile tissue of the penis. So those nerves are important. Oops, let's put the penis back together here.
For those of you listening, she has this fabulous model and her penis just fell off of it, so it was great.
Yes, part of the penis just fell off. Again, not what happens in pelvic therapy or during prostate surgery. So the erectile tissue, again, are comprised of three types of really highly vascular sponge-like tissue that are the main structures involved in an erection. But you have to have an intact nervous system
Mhm.
and blood supply in order for that function to happen. And during a prostatectomy, that is compromised, and that's why there is severe sexual dysfunction. Another thing that men after prostatectomy also struggle with is incontinence, because the internal urethral sphincter is damaged or injured
Mhm.
or compromised in some way. So then you just have the other continence mechanisms that support you, which are the external urethral sphincter, that's part of the pelvic floor, and then the supporting urogenital pelvic floor muscles as well, that are again intimately connected and hugging the erectile tissue. And so in pelvic therapy, we are helping to support or facilitate urinary continence control, because that is a major number one thing that is going to impact sexy time
Mhm.
function. Because
Yep.
if you're leaking and you feel like you can't control your bladder, that's going to impact your desire or motivation to socialize, to go out, to
Mhm.
date, to even have sex, because you're worried that you might leak,
Yep.
and your body confidence and your self-esteem and trust in your body to do what it's supposed to do, is keep things in, is compromised. And
Mhm.
so that's the biggest thing that men want to take care of. But the second thing after that, so once bladder recovery comes back online, which again can take a few months to several months, again
Mhm.
depending on the extent of that person's unique presentation of surgical
Mhm.
implications and health. Then we're talking, well, immediately I'm always bringing in sexy sexual function,
Yeah.
because using a penis pump is very important here. Like taking your penis to the gym
Yep.
is necessary, not just to preserve penile function health, but also to help with your bladder control. So there
Mm.
is some, a little bit of research out there that is showing, and it's showing promising, that if you use a penis pump early on, that actually can improve your bladder control
Hmm.
function. So I talk to guys about, after a prostatectomy, if all things were in order before the surgery, generally men will have several nocturnal erections at night. So these
Mhm.
are non consciously driven, can last a few minutes to several minutes at a time, but that's how your penis gets healthy blood flow
Mhm.
and exercise. And when you have a prostatectomy, that's gone. So, how else is your penis supposed to get exercise?
Right.
A vacuum erection device or penis pump is a great way and a crucial tool in order to preserve penile length,
Mhm.
because the length is going to be shorter. They have to reconnect the urethra, which means you're going to lose a few centimeters here. That's normal because of the
Mhm.
procedure, but you want to continue to maintain what length you have and
Yeah.
preserve girth and function, muscle function, tissue mobility and flexibility, and communication with
Mhm.
the rest of your body, your bladder, and the nerves there. So, vacuum erection device, take your penis to the gym is very imperative.
Mhm.
And so that's the sexual recovery part of things. But to your point, Stephanie, of there's a lot of grief and loss here that
Mhm.
we have to hold space for. Their body has gone through this huge change,
Mhm.
and they're trying to find the new normal. And that's really difficult,
Mhm.
because pleasure, or at least penis-centric identity for someone who's masculine, who's a man, their penis function is part of their identity.
Yeah.
And when that is compromised in some way, that can be very disorienting,
Mhm.
destabilizing, and depressing. And so having someone like yourself and myself to open up the conversation around how has this whole journey impacted your sex life?
Mm.
Is this important? Is this even important for you? Right? We're
Right.
not making assumptions. Maybe it is not important for someone, and that's fine too.
Mhm.
Everyone's got freedom.
Yep.
But if it is important, we should talk about it. And that's where the love urologists, love them. Thank you for all the work that you do. However, they're not great at
Mhm.
having these conversations
It's
around
very true.
sex, right? Like they're
Yeah.
not saying you should get a penis pump and maybe you should talk to a sex counselor, a sex therapist, and
Yep.
let's start to reconnect with your intimacy and find what that is now. And how do you cope with the grief and loss of a functioning body part or a relationship dynamic or a way that you've really connected with yourself, satisfactory and with pleasure like that?
Mhm.
Things are different now. And
Yep.
so I think having that opportunity to discuss that and put it on the table is very therapeutic for people because they do not know who to go to,
Yeah.
what to say, how to talk about it. And they're lucky if they're even given a handout to do pelvic floor
Yeah.
exercises, but they're especially found a unicorn if they're telling them to get a vacuum erection device. And certainly they're not showing them how to use it properly either.
Right. So it's interesting because urology, like many areas of medicine, has different specialties. And if you are a prostate cancer specialist, a lot of times you are focused on getting that cancer gone and
Mhm,
not looking at their whole life and how everything is
mhm,
affected. And even if
mhm.
they have the most perfect prostatectomy with the least amount of damage, there is still, for the first several months after that, inflammation, angry nerves, all of these
Yeah.
things. So you might get back everything that you had, but I guarantee
Mhm,
you for at least 1 to 3 months, you don't
mhm,
because you have
uh-huh,
to let everything settle down and you have to do your exercises. I happen to be a urologist that loves sexual medicine. So I have penis pumps in all of my exam rooms and I have posters on the wall and I talk about all this stuff. So my colleagues that specialize in prostate cancer send their guys to me for penile rehab and I also refer to pelvic floor physical therapy because it
yeah,
is so important.
mhm,
But I love what you said about doing the pump to help with the urinary part too, because a lot of times we separate the two issues. We talk about
mhm,
incontinence, we talk about sexuality and the use of the penis, and we don't talk about that there is that interconnection. And so I love that. I always tell my guys, the penis is a body part just like your bicep. If you don't use it, you lose it. And use your penis pump because we want to maintain length, we want to maintain girth, just like you said. And I tell them the same thing, take your penis to the gym. It's not whether you end up using your erection for pleasure or not, I don't care. Go for it or don't. That's totally up to you. But you need to exercise the penis
yeah.
regularly. So I love that you brought up the interconnection of the urine and the erections. Yeah, it's awesome. So, okay, so a guy who maybe didn't go through the full prostatectomy, but had hormone therapy, radiation therapy, they have compromise as well. And some of it is different because of the way that the radiation affects the tissues versus removing
Right.
something.
Right, exactly. So when you're removing something, the effects are immediate.
Mhm.
The after effects are immediate. With radiation, it's a little tricky and deceptive because you may actually have no compromise of your tissues and function in the beginning.
Mhm.
With radiation, something called radiation fibrosis, that happens over time. And that can be a few years
Mhm.
to several years until someone actually starts to notice the after effects of that treatment. There's
It's
no,
so
no,
interesting. I have guys that come in 3, 4 years after their radiation, and all of a sudden they're
right.
having incontinence. All of a sudden
Yes.
they're having chronic pelvic pain. And I'm like,
Correct.
yeah, it's post radiation. And they're like, what? That was years ago.
Right.
And I've been fine this whole time. And I'm like,
Right.
it doesn't matter. Those changes continue to happen and ruin those tissues.
Unfortunately that is a thing. And fortunately though, for them, there is therapy, right?
Mhm.
So we work on mobilizing tissue of the prostate, pelvic floor, because it's not just the prostate, but it is the surrounding tissues,
Mhm.
just depending on the type of radiation you had as far as implantable seeds and things like that. But yes, we do want to preserve as much as possible a
Mhm.
healthy tissue mobility and function, coordination and strength and tone to support bladder, bowel, and sexual function.
Yeah, it's really important. And, a lot of these guys don't think that they're going to need this because they didn't choose the prostatectomy. And
Right.
that's something that I've learned the longer I've been in this world is
Mhm.
educating the guys when they're choosing their treatment that look, regardless of which treatment you choose, you are going to have erection issues. You are going to have urine issues. It might not be right away, it might be later on, but you will have compromise from your treatment, regardless of which treatment you choose. I think some of them really think, well, if I do the radiation and hormone therapy, it'll be like this short window of when
Right.
I have some compromise and blood flow issues or whatever, but then I'm going to be fine. And that's not
Mhm.
necessarily the case.
No, there's different varying levels of degree of the after effects or what people experience for certain. And we do know though if nutrition plays a role and fitness as far as exercise, all these basic lifestyle factors are
Mhm.
going to support their ecosystem. Whether you just had a diagnosis, don't have a diagnosis, or after the diagnosis and treatment, it doesn't hurt to you start if you're not doing this already, implement diet, nutritional factor therapy, exercise, lifestyle. All of these things are going to help support a healthy functioning body. So
Mhm.
that can never hurt you. There's no
Yeah.
negative side effects.
Yeah, absolutely, absolutely. All right, so with our men, what is something else that they come to see you for? We've talked about the, scrotal pain, testicular pain. We've talked about post prostate cancer.
Mhm.
What's something else that they come to see you for?
Yes, ejaculation
Mm.
concerns. So there's two sides of that with ejaculation concerns. Ejaculating too quickly or
Mhm,
before they want to, and not ejaculating at all or not unable to reach orgasm.
mhm,
So both of those are termed in the mainstream media premature ejaculation on one side, delayed ejaculation on the other. I just like to call them ejaculation concerns, ejaculatory inhibition, or ejaculation hyperactivity or sensitivity, etc.
mhm.
Because a lot of these terms, the language, right, has a lot of meaning. And I like to really buffer that as much as possible
Yeah.
because normalizing that your body just, it's not an issue unless it is
Mhm.
distressing to you or to your partner and it's persistent and consistent and causing distress. Now, there are some men who enjoy coming quickly. That's not
Yep.
a problem for them or their partner. And there are some men who maybe they orgasm or maybe they don't orgasm, but they find their experiences very pleasurable and they have
Mhm,
multiple peak pleasure moments and don't ejaculate because
mhm.
ejaculation and orgasm actually aren't the same, even
Right.
though for men it often happens in tandem. There's a bit of separation there because
Mhm,
orgasm is an internal experience of the peak pleasure of moment in time. It's very vague, it's subjective. There's a lot of physiological things that might happen with orgasm, but no one can really put a definitive definition on what orgasm really is because it's so personal and subjective, just like pain. So, in any case, I like to normalize perhaps these situations of whether you're ejaculating too quickly or not soon enough, that there is a level of normalcy within that.
mhm,
Now, certainly, if it is distressing, then we want to address that. And so part of that is the psychosexual education
mhm,
aspect of how erection and ejaculation physiologically work in our body and what factors play into our experience of pleasure or extending our pleasure experience. And that also falls into the psychological and the social cultural interpersonal dynamics because that also plays a role, which
mhm.
these two bubbles here, so we're talking about the biopsychosocial lens. The biological stuff, the physical stuff, men really gravitate towards.
Yeah.
But then when you start getting into the psychological, the mental emotional, the relational aspects, it's very hard because it's very abstract, but it's hard for them to kind of think of like, well, that's causing these
Mm,
things are actually supporting or not supporting this issue that I'm experiencing, right? And so it's a gentle exploration of that. It's a
mhm,
gentle kind of nudging towards that your whole being is an ecosystem and all of these things have stake in them,
mhm,
but some might have greater stake than others. So, as a pelvic floor physical therapist who's also a sexuality counselor, I can bridge the gap between both worlds, right? So we do address if in fact is pelvic floor dysfunction or issue. Like for example, I'm going to talk about premature ejaculation. With premature ejaculation, the literature and in my own personal clinical experience, there's often an issue with coordination and timing and
mhm,
voluntary relaxation of these muscles that can contribute to exacerbating of these symptoms or concerns. So if we're noticing that there's greater tone, if we're noticing that the pelvic floor muscles are having a hard time with timing and coordination of
Hmm.
contracting and relaxing, because when you ejaculate, these muscles involuntarily squeeze, let go, squeeze, let go, squeeze, let go, so that it moves fluid out of your penis
Yeah.
during ejaculation. Now, what happens when, like, you don't have that range of motion or things are already upregulated to begin with? Like your arousal system, and not just sexually, but we're talking about emotionally as
Hmm.
well, like anxiety or nervousness, and how you're living your life outside of the bedroom
Hmm.
matters, because that is your level of baseline arousal. Okay. And I mean nervous system arousal.
Yeah.
So if we're kind of like go, 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 go up here, do high energy, and then we expect that to like be different during sex, I'm not sure that's going is a realistic expectation, because that just means your trigger reflex to ejaculation, which operates under the sympathetic nervous system,
Hmm.
which is that high energy, fight flight nervous
Yeah.
system, is ready to go. It's already primed. And there isn't much room. There's no wiggle room to have when you're already adding more stimulation and more excitement to the system. So yeah, you are going to feel
Hmm.
like I can control my ejaculation, or I can
Yeah.
extend my pleasure experience from that perspective, because there's the capacity is really low.
That's such a great example. Yeah.
Yeah, there's a wonderful research paper that just came out in 2025, hot off the press, that looked at pelvic floor training, so pelvic floor muscle training, behavioral therapy, and focused diaphragmatic breathing. And
Hmm.
so they had two groups, one group that had the pelvic floor muscle training and behavioral therapy, and then the other group that had focused diaphragmatic breathing, pelvic floor muscle training, and behavioral therapy. And what they found was certainly both of those groups did improve their time to ejaculation or extended their pleasure experience. But the group that actually did the breathing focus exercises did significantly better than the other group. So
Interesting.
yeah, so working with your breath to regulate your nervous system is an important part to neuromodulation of these reflexes. And so, mindfulness activities, breathing, being in tune with your sensations, recognizing your level of arousal and the gradient, and then
Mm.
being able to shape and shift within the sexual experience. Not an abrupt, I'm not a fan of these techniques of like start and stop, or squeezing the head of the penis, because it's
Mhm.
reinforcing a stop, 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 stop. Like I'm doing something,
Yeah.
something's bad gonna happen, right? No, because that's just feeding into the problem. What
Mhm.
you want to do is you want to recognize your level of arousal and then begin to shape and shift fluidly within your experience. Maybe you do choose to slow down, shift gears,
Mhm.
focus on your partner a little bit, but you don't have to make it a neon sign like, I gotta stop, hold
Yeah.
on. You know what I'm saying? There's
Right,
a different
absolutely.
energy there.
Yeah, no, that makes so much sense. Like, if you're already so, high strung and in, the flight or fight mode, and you're gonna have sex, it just totally makes sense that you would orgasm too quickly if you haven't learned how to calm that system down, and
Yeah.
the breath work is awesome. I mean, I love that is coming out in research.
It's so important. And also, pain can be part of the
Mhm.
situation. So, we know if someone is experiencing sexual pain, as up to, I think that research quoted like 70, don't hold me hard on these numbers, but 74 ish of men who experience pelvic pain also experience premature ejaculation or
Mhm.
ejaculation issues. So, there's a correlation. Why? Because things hurt, there's nervousness, there's anticipation, there's
Mhm.
worry. So your nervous system is upregulated. And certainly, if you work on the calming of the nervous system, helping with the pain problem, that is certainly going to help you access your pleasure, feeling more
Yeah.
comfortable in your body and more relaxed, which is going to help with everything else.
Yeah, and the thing is we don't have great medicines for premature ejaculation. The SSRIs that we use the delayed ejaculation side effect for come with their own slew of side effects. And I really don't like using them. So I love knowing that there's an alternative that we can help our guys with to find a better balance and a better level of pleasure that they want. Because like you said, there's nothing wrong with whenever you reach climax is when you reach climax. It doesn't
Yeah.
make you wrong or bad or anything else. But if you do want to last longer and enjoy a longer pleasure session, then I love that there's these interventions that we can do without using some of those medicines because I really don't like them.
Right. Yeah.
Yeah. And how about our delayed ejaculation guys? What can they do to kind of increase their ability? Because for some of them, I know guys, I have patients that are fine if they don't orgasm, but their
Right.
partner's really bothered by it. And so they want to achieve that so that their partner still feels wanted and
Mm,
things. And that's a whole nother conversation about helping that
certainly.
partner and the mental part of all
Right.
that. But if they do want to work on that, what are some tips that you can give for that?
Right. And that's such a great point that you're bringing up is how do we kind of reconcile, like, how do we help the coupleship co create a pleasure experience
Mhm,
that works for both of them with understanding and obviously with compassion? And I think open communication is the first thing,
mhm,
whether it's premature ejaculation or delayed ejaculation. I think communication about what's going on for you and how you feel
mhm.
about things is really important to lean into if you're in a partnership.
Yeah.
The second thing is what are the potential contributing factors to delayed ejaculation? So some men think that as they get older this is common or normal. It may be, but not really.
Mhm,
It all depends on the type of sometimes we get into sexual routines.
mhm,
And sexual routines are routines.
mhm.
They eventually just they're not enough stimulation to get us where we want to go.
Yep.
Because it's the same old thing. So it's like, I always like to liken this to if I have the same meal every day. So let's say, for example, I go to a restaurant, I have a meal, I never had it before, it's great. I might have it 2, 3 times, I still loving it. But if I had that same thing over and over and over and over again, eventually I get sick of it and I'm like
Yeah,
super bored. Give me something else, right?
yeah,
Like I want something new for my taste buds. So with the same goes with delayed ejaculation. The level of arousal, the gradient on the inside doesn't match what their penis is doing. So
mhm,
their penis is fully generally erect, ready to go, but on the inside that erotic energy does not match what physiologically is happening, which is called
mhm,
arousal nonconcordance. Now, here's the thing often that I see when I'm working with men. The routine is I help my partner get off, focuses on them, all on them until they get off, and then it's my turn and it's
mhm,
thrusting. Thrusting may have helped you when you were younger because there were just a lot of other factors biologically going on that were supporting that process a
mhm.
little easier, right? Hormones, what
Yeah.
your the state of your body, your health, relationships, etc. As we start to evolve in our relationships or continue with that, and it's a we're in long-term relationships, and we're still doing the same thing, there is not enough time for your erotic energy and your embodiment of your own pleasure to occur in that moment
Mhm.
before you start resting.
Yeah.
So all of the energy and external focus was here on your partner, which again can be very pleasurable, don't get me wrong, but you're not feeling, you're not in tune with your own pleasure sensations or embodying your own
Mhm,
sensations in your body because it's out there. And there isn't this like dance that I often recommend people do is share in giving and receiving
mhm,
within a sexual encounter. Like maybe you do some intercourse, pepper that in throughout. It doesn't have to be the finale. Who
mhm,
said intercourse has to be the finale? Why can't intercourse be in the beginning, in the middle, and the end, or somewhere in between? You know, and then have a shared moments where you can receive touch and
mhm.
feel in your body without doing out here.
Right. Yes.
You know, don't
Yes.
spectate, right? And then if it's been a pattern for a long time too, we have to recognize that there's an anticipatory prediction.
Yeah.
If I have sex, I'm either used to I'm going to come really fast or I'm not going to come at all. That
Mhm.
is an expectation that's already there, whether consciously or non-consciously aware,
Yeah.
right? So it's just a pattern of things going on based on the environment and what you're doing and what you're not doing, etc. So
Mhm,
it's mixing it up, sharing and giving and receiving so that you can actually sit back, relax, and ride your pleasure sensations. It's very important to connect with throughout the sexual encounter. The other thing to name here too is certain practices. So, like for example, edging practices, which
mhm,
again can no harm or foul with edging practices. They work for a lot of people. They feel great for a lot of people. But if you're stunting your climax, you're
mhm,
intentionally preventing it from happening over and over and over and over again, that particular pattern, neuronally, neuromuscular, all of that is going to adapt. And then it's
mhm.
going to adapt in such a way that you're not going to like, because then coming in a partner situation might be very difficult.
Right.
because there's a pattern here that's been wired, right? Like no
Mhm.
climax, no climax, no climax,
Right.
right?
Right.
So I when I work with people who have delayed ejaculation is it or a premature ejaculation, it's like what are your sexual behaviors?
Yeah.
What are your masturbation habits and styles? The other thing too with either of them is when this is again, maybe I'm stereotyping. I don't have a penis, last I checked. But men are very rigid in their bodies when they're masturbating. It's just hand and penis. That's
Yep.
it. But it's like sex is a contact sport. It's a full body
Yeah.
experience. And so like start to bring your body into it. Start to move your pelvis. Start to embody all the flavors that your body has to give you and offer you. It's not just your hand on your penis. And a hand will never mimic a vagina. So I think it's important
Right.
to vary stimulation, to start to explore with different sensory aspects, embody that, practice with yourself, then
Mhm.
with a partner. And first and the most important takeaway here is for premature ejaculation or delayed ejaculation is take pressure to perform off the table. Take the
Yes.
pressure to perform off the table. As long as that pressure is hanging over you, the expectation to perform or be or do in a particular way, you're immediately setting yourself up for disappointment.
Yeah. 100% agree. The other thing that I'll add in there is porn use. If you consistently watch the exact same type of porn and that's what gets you off when you are by yourself, when you are with a partnered situation, if you are not experiencing that same type of visual stimulation and mental stimulation, then you also have climax issues. So that's one more caveat that I'll add because that has been, especially with my younger men, that has been an issue more so in the last few years than it was previously because porn is everywhere now. It's on your phone, it's in your hand,
Yeah,
it's everywhere. And so it's so much more accessible. And so that's one more that I'll add to that because I think that that's a big thing too. It's not, you're right. You use your hand in your penis and you're watching the same things and you're in the same position and you're
right,
all those things. And I love to counsel my patients that just because you're having an intimate situation with your partner doesn't mean that you have to climax. There are different
right.
ways to enjoy pleasure. Maybe today is all about partner A and tomorrow's all about partner B.
Mhm.
Maybe you both climax, maybe neither of you climaxes today.
Yeah.
So I think that just kind of like you said, take the pressure off, enjoy and just be whatever that session is going to be really does make a difference in just the enjoyment and the pleasure that you can receive out of that session.
Absolutely. And there are two things that I also wanted to name as well that I didn't before. Medication side effects are a thing.
Mhm.
And that in or out, I'm sure you're aware of that for either
Yep.
of these situations. And the other thing is pelvic floor muscle training. Again, as a
Mhm.
pelvic floor therapist, if you have weak pelvic floor muscles, in order to ejaculate or appreciate orgasm, muscles they have to be healthy
Yeah.
and there has to be a robustness to them.
Yeah.
And so that may be part of the picture, but it's only, I like to tell people it's not just that though.
Right.
So
Yeah,
so it's
no, your
very
ability to
real.
get an erection to climax, it is multifactorial. I
Yes,
tell my patients that
yes,
all the time. Like,
yes,
and medication side effects are huge, and so
yeah,
are disease side effects. If you
yes,
have diabetes and your nerves start to get damaged, your peripheral neuropathy is not just in your feet or your toes, it is in your
that's right.
wiener.
Yes. Thank you for that. Yes, PSA announcement. Yes, diabetes,
Yep.
cardiovascular disease. Yes,
Yep.
big one,
Yeah, I
big one.
tell my patients all the time, it comes down to nerves and blood flow. And if you don't have the good musculature, you don't have good blood flow from a variety of reasons, plaque buildup, hypertension, different
Right,
cardiovascular issues, you
right.
have nerve damage from diabetes, back injuries, whatever.
Mhm.
You are like up a crick without any paddles, and you have to start at ground zero to get yourself back to a healthy sex life. And we
Mhm,
might need pelvic floor physical therapy,
mhm,
psychosocial therapy. We might
mhm,
need medications. We might need injection therapy, penis
mhm.
pumps, but we
Yeah.
have all of these tools that
Mhm.
can help you. And we have professionals like the two of us that can help you. And so, bottom line is don't be afraid to tell us that something is going on or your own provider that something is going on, because even if they are uncomfortable or don't know how to handle it, they can refer you to somebody like us who is completely comfortable talking to you about your sex life and your penis.
That's right. Love it.
What a fun conversation today. I have been wanting to do a male pelvic health session for a long time. So I'm so happy that you're here today. How can people get in touch with you? How can they follow you? Go ahead and plug yourself here a little bit.
Oh, thank you so much for the shameless plug. So my website is drsusieg.com. That's drsusieg.com. And you all are welcome to join my exclusive Patreon community, which we have 600 plus members and growing, of 99% men or male identified in this space, where I include live demo tutorials related to all the topics that we've talked about today, educational videos, community chat rooms, resources, and so much more in this community. So check it out. It's patreon.com/Dr. Susie G, DRSUSIEG.
Awesome. I love it. And we will put links in the show notes as well. So you guys don't have to try and remember that as you're driving and try and writing on your steering wheel or whatever you're doing right now. So it'll be in the show notes for you to find. And thank you so much, Dr. Susie. What an amazing conversation, and such certainly a not talked about enough subject here today.
Thank you so much, Stephanie, for having me.
You're welcome. Everybody have a fun week and go have some fun between the sheets. Thank you for joining us and exploring sexual health topics here on Between the Sheets. New episodes are available every Wednesday. Please subscribe and rate our podcast so we can reach more listeners. And don't forget to tell your friends, partners, and anyone who will listen about Between the Sheets. Send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. It's all one word, podcastbetweenthesheets@gmail.com. Thanks for listening, and go have some fun between the sheets.